Hi, I'm Dr. Jeffrey Antimarino. Welcome to Outtakes. This is our second episode of our newest campaign where patients will send in videos that mostly from TikTok and want to find out my opinion. The first episode was a lot of fun. There were some crazy videos that you sent in, so I enjoyed those. This one, I think the videos were a little bit better, a little bit more educational, and so I wanted to kick off. The first one is about red light therapy. That's been a buzz for a while. I think there is science behind it. There are a lot of studies that are showing some benefit of red light therapy, stimulating collagen and stimulating the mitochondria, which is an organelle inside the cells that can help repair tissue. I just want you to be careful because there's a lot of red light therapy devices that you can buy at home. It's going to be much better if you do it in a doctor's office. They're going to be stronger. So the studies do show that the efficacy of what you can buy at home is probably not going to be that beneficial. But if you do it in the office, there's been a lot of benefit to that. So I'm behind red light therapy. Let's skip down to threads and Sculptra. So another big topic. I'm not a fan of threads in any form. Threads have been around for a long time, even when I was training, so late 1990s, early 2000s. I don't think they work. I think they can cause problems. A lot of times they're being done in an office, usually by somebody who is not a surgeon. They are really not hooked to anything. So you put these threads in, they have little barbs on them, you pull the tissue back, the barbs hold them in place, and then over time your tissue just falls forward again. You're not suspending it to anything. So the problem with that, it can cause pain, asymmetry, and other even contour deformities. We've seen the results of that in the office. I would tell you to stay away from them. They didn't work in a surgeon's hands in an OR years ago. I'm just not a big fan. Sculptra, I don't use Sculptra here in the office. I've heard great things about it. I'm sure it's a great product. I have colleagues that love it. The reason I don't use it is because I want something that I can control. We use hyaluronic acid products in the office because if there's an issue or a patient's not happy with it, we can dissolve it. You can't dissolve Sculptra. I've seen some terrific results of patients that have had it done. So I don't have any problems with it. I just don't like it, and for those reasons I can't control it, and that's why I don't have it here in the office. Lymphatic massages and facials, I think those are fantastic. We use lymphatic massages after many of our procedures, including facelifts, tummy tucks, liposuction. So anything that you can be doing to move that kind of that fluid that builds up in the tissue, that edema, works well. I think facials are fantastic, and there's different ways of doing it, different levels. But I think anything that you're doing to keep your skin healthy and keep that outer skin that gets sun damaged and wind damaged, I think when you can keep that down to a minimum, I think that's a good benefit. So if you're doing it, keep doing it, but I think there's good benefit to that. The next one was really about breast augmentation with fat, yoga boobs. There's a lot of stuff in the media now talking about different things. So I just wanted to spend some time talking about breast augmentation, how I do it, and just different implants. So let's start with fat grafting. I'm not a huge fan of fat grafting for a primary augmentation, and this is why. I think breast implants are safe. I like the silicone implants. We'll get into some of the different advances in those in just a few minutes, but I think if you're going to enhance the volume, then an implant is a one and done procedure. There's mild or minimal complications with it, but it works well. I think fat grafting to enhance an augmented breast with an implant, I think that works okay. It's done superficially, small amounts of fat. The reason I don't like fat grafting by itself is, number one, you have to have enough fat to transfer. A lot of women don't have enough, and you don't think, every woman that I've met always thinks they have a lot of fat to transfer, but many of them don't. So you have to have the donor site, number one, and you may not be a candidate. Number two, when you transfer fat, not all of it takes or survives the transfer. It's living tissue. You're removing it from an area with blood supply. You have to transplant it to an area and it has to reestablish that blood supply. So you have to be limited in activity, limited in pressure. You can't sit on it, if it's going to your buttock area, but on your breast, you can't lay on it. You can't have any pressure on it. It really kills the fat. You can only transfer so much. And so anybody that does fat grafting to a breast, they realize you can only get maybe a half a cup to a cup size in a single transfer. So many women will need 2, 3, and even 4 transfers, which makes the cost exorbitant. And so instead of 1 surgery, now you're looking at 2, 3, and 4 surgeries. Also, when the fat, if it doesn't take, a lot of times it can be reduced to oil, and you can get oil cysts, which cause redness, inflammation, pain, and so sometimes they have to be drained. So there's that complication. Another is that sometimes when fat doesn't take, it can calcify and you get microcalcifications, and that's what I'm worried about. I still do a lot of breast cancer surgery. I don't want a woman having microcalcifications because of an aesthetic fat grafting that shows up on a mammogram, and now that the radiologist reading it might think they have breast cancer, and now they have to undergo a biopsy. So again, cost, the number of surgeries that you have to have, when you can do it much easier and technically more safe with an implant, I still think implants are the way to go. Now that being said, there is a lot of talk about some new procedure about the implant being above and below or a dual plane. Implants placed under the muscle are always dual plane. That has been that way for decades. This is not a new concept, but because it hits the social media, they talk about it like it's the first time it's ever been done. It's been going on like that. I've done it that way for over 20 years now. So what that means is the implant is under the muscle, and that's the only way I do it, and I'll tell you why in a second. But the anatomy of the pectoralis muscle is it comes across the collarbone, down the sternum, and then over to about halfway across the chest, and then it starts to angle up toward the arm. So when the implant's under the muscle, about 1/3 of that implant is sticking out from the muscle. It's not over the muscle, it's just sticking out. It's still under the level of the muscle, but it's outside of that. And that's what that means. There's nothing fantastic about it, that's just the way it is. The reason I like them under the muscle for me, and I tell my patients at this point it's a non-negotiable, is for mammogram surveillance. Implants under the muscle do not interfere with a mammogram. Radiologists tell us as plastic surgeons that if you put the implant above the muscle, up to 15% of breast tissue may not adequately be visualized. Even in today's newest MRI scanners, mammograms, and ultrasounds, you can miss an early cancer with the implant above the muscle. I'm not willing to do that to somebody. There is a big push with colleagues to start putting them above the muscle. That's the reason I don't want to do that, is because I want my patients to have mammograms with good screening. I don't want anybody to come back and say that we missed something because my implant was in the wrong spot. So that's my personal way to do it, and I think it's the right way. That being said, let's talk about yoga boobs, which is another thing that's in the social media. And that really just means that women are opting now for smaller breasts, which is not a problem. I think breasts should be elegant. They should match your body habitus. I think we've finally gotten away from that bigger is better mentality, because that was never a good outcome as far as I'm concerned. I think the breast volume and shape should match your body habitus. And so when women, especially very thin women, are opting for smaller implants, I think it's the great way to go. And so let's talk about implants. So there's 4 implant companies now. The oldest 2 are Allergan and Mentor, which I think are great. I use both of those. Sculptra is another one that's been around for a number of years. I've never used those implants. The nice thing about Allergan, they make a thickened shell. I've used them for years. I've had great success with them. I think they're a good company. Mentor, I also think, is a very good company. The nice thing about Mentor is they have been the only company that has finally been able to produce an implant larger than 800 cc's. They now have them from 900 to about 1450 cc's. For reconstructive purposes, that's fantastic. I just used those sizes on a patient just recently with great outcomes, and she's very happy. There are some ladies that their body habitus requires an implant that's more than 800 cc's, because remember, they do not have any breast tissue after the mastectomies, so we're trying to make up that volume. And so for the first time ever, we've been able to do that, and I've been very pleased, and congratulations to Mentor for finally being able to do that. The last implant company that I just started using and I really like is called Motiva. They have been in South America and Europe for about the past 12 to 14 years with good science behind them. It has been studied in this country since 2019 and just finally got their FDA approval in October 2024. This is a Motiva implant. The difference in science with this implant is that the gel inside there is cohesive, just like all the other companies, but it's slightly more viscous. But the brilliance to this is the shell is slightly different. It's not textured, but it's a slightly different shell, so that the scar tissue that forms around this implant is thinner. So the problem with capsular contracture that we've had in the past is now much less with this implant. The other beauty about this implant is that the designers have been able to figure out how to fuse the gel to the shell. And what that means is when you hold an implant on its side, the other implants would ripple a little bit. This implant doesn't ripple at all. The gel stays with the shell, and since it doesn't float to the bottom, the maximum projection is in the middle of the implant, which is where you want it on the breast itself. So I just started using that recently. The patients that have chosen that, and I give them the choice of different brands, have been really happy with it. So I think there's been some really good things that have come about in the implant world, and I think with these implants, technically silicone gel implants can last anywhere from 25 to 30 years safely, and with the newer one with Motiva, because it's so much more stable, I think you might even get longer longevity out of that. So all the stuff you've read about where implants need to be changed out every 10 years and monitored is pretty much out the window now. So I hope that answered some of your questions. This was a lot of fun. I look forward to the next set of videos that'll be coming in. So if you're want to participate, make sure you get your videos into us or the links so that we can look at those, and I'll see you next month.